and Ayurveda. So far in our series of Livayu Talks, we've delved deep into various health topics like diabetes, joint pain, immunity, and many more topics. In today's session, we'll delve deep into the subject of using Ayurveda for the maintenance of cardiac health. With our fast paced lifestyle, as usual, the prevalence of cardiac conditions is on the rise among Indians, particularly among the working class population. In light of this, we are fortunate to have Dr. Hari Mohan Chandola with us today to shed light on how Ayurveda can provide insights and strategies to effectively maintain and improve cardiac well-being. So, thank you, Dr. Chandola, for being here. A quick introduction about Dr. Chandola. He is a doctor in of medicine in Ayurveda with a PhD in Ayurveda and a diploma in yoga from Banaras Hindu University. He also holds the esteemed position of chairman of three prestigious committees. These are the Research Committee and the Institutional Ethics Committee at Uttarakhand Ayurveda University, as well as the Institutional Ethics Committee at CH Brahm Prakash Ayurved Charak Sansthan in New Delhi. Previously, Dr. Chandola served as the Director Principal of CH Brahm Prakash Ayurved Charak Sansthan under the government of NCT of Delhi. He's also held the positions of HOD and Dean at IPGT and RA at Gujarat Ayurveda University, and professor and hospital director at Uttaranchal Ayurvedic College and Hospital on Rajpur Road, Dehradun. Dr. Chandola has authored numerous research papers and guided 60 PhDs and PG diplomas till date. He's delivered lectures on Ayurvedic medicine around the world, including the USA, Germany, Portugal, Malaysia, Poland, and Sri Lanka, among other countries. In recognition of this remarkable contribution to the field of Ayurveda, Dr. Chandola has been awarded the Lifetime Achievement Award in 2014 and the Life Tree Award in 2008 and the Veenaben Patel Istam India Award for Excellence in Teaching Ayurveda on 21st January 2023 at New Delhi. So, thank you so much for your time, Dr. Chandola. It is an honor to have you here and learn more about the Ayurvedic ways with you.
Thank
So,
you.
diving right into the questions. So, Dr. Chandola, can you tell us what are the symptoms of an unhealthy heart?
Yeah, it is discussed in detail in general in the Ayurvedic literature about the under the heading of Hridrog. And the main symptoms are the most important is the chest pain, which is described as a urahashul, then chardi, that is vomiting, pramoho, that is stupor, aruchi or anorexia, kaphotklesh, that is nausea, trashna, that is increased thirst, shwas, dyspnea, murcha, fainting, and hiccup. So all these symptoms are well comparable, which we find in the modern day context of the cardiac diseases. These are the symptoms in general. And then they have also discussed dosha is specific depending upon predominance of vata, pitta, kapha, and combination of all these three doshas followed by Krimi Hridaya when this worm infestation also take place. And in both the last two conditions, there is a severe chest pain, which is well seen in myocardial infarction also.
Okay, okay. So, many different symptoms that can be there, and also the vata or the doshas are also a contributor or a sign of this. Remember, audience, you can always go to Livayur to use the dosha tool, and if you're curious, find out more about your own doshas. So, Dr. Chondolo, coming back to this, how does Ayurveda address the root cause of cardiac diseases?
As I mentioned that Ayurveda discusses about the role of vitiation of these three doshas, Vata, Pitta, and Kapha. When there is a derangement in the balance of this Vata, Pitta, Kapha that provoke these doshas and predispose the patient to cardiac disorders. And when we talk about the root cause, there are various factors mentioned about incompatible diet, that is Viruddhahar, then Veg Vidharan, suppression of natural urges, injury over chest, fear, anger, and chinta, that is worry. So all these can be covered under the broad heading of stress. So the care is to be needed to be taken by taking proper diet and lifestyle, and taking care of stress management by dincharya, ritucharya, etc. So we can take care of the root cause. And for that purpose, the fruits like bale, bear, anar, falsa, chakotra, amla, nimbu, that is lemon, can be taken. When we talk about the dairy product, haldi doodh and buttermilk can be taken. Among the pulses, arhar, moong, chana dal, dal moat. When we talk about the oils, the flaxseed, that is alsi, and sarson ka tel are the best. So if we take proper diet, proper lifestyle, and nourish fruits and stress management, we can take care of the root causes rather than the symptoms.
Understood, understood. Usually people end up confusing root causes for symptoms, but really taking care of root causes through diet, lifestyle, and stress management practices, you can really save yourself from cardiac disease. So, Dr. Chandola, how does Ayurveda, you mentioned stress management. So, wanted to ask you, how does Ayurveda view stress management in relation to cardiac health?
As I mentioned that among the causes, they have discussed about the role of worry, fear, anger, and suppression of natural urges. All these work as a stressor. Lot of work has been done to define on scientific line about the suppression of natural urges. And it has been seen that by suppression of natural urges, like suppression of urge for urine, feces, flatus, tears, the level of catecholamine in the blood goes up. That is sum total of epinephrine and norepinephrine. So these agents are vasopressor agent. They constrict the blood vessels and hamper the blood supply towards the heart.
Okay.
So suppression of natural urges should be understood in terms of stress. So proper stress management can be done by our major drugs like ashwagandha, shankpushpi, brahmi, jyotishmati, jatamasi, etc. So they take care of this disturbance in the mental health.
Understood. Interesting. Now, one of the main reasons we hear nowadays is that, cardiac disease is due to cholesterol and fats building up. So, can Ayurveda help in reducing cholesterol levels and improving lipid profiles?
Yes, we have good medicines, evidence-based medicine, which take care of the disturbed cholesterol and disturbance in the level of lipid profile. For
Okay.
example, guduchi, garlic, pushkar mool, that is inula racemosa, and trifla, which includes Terminalia cibula, Terminalia bellerica, and this Philanthus officinalis, that is amla. Neem oil. Neem oil has got very good effect on this disturbance in the lipid profile, and this garlic effect is also very well known. So by
Okay.
administering these safe herbs, we can take care of the disturbance in the level of cholesterol, triglyceride, phospholipids, free fatty acids, and other part of this good cholesterol can be promoted, bad cholesterol can be reduced by these
Reduce.
herbs.
Okay, understood. And disclaimer to the audience, never really administer these herbs or any medicines mentioned here by yourself, because at the end of the day, they still are medicines and require a professional like Dr. Chandola here to administer them. So, moving on, Dr. Chandola, are there any Ayurvedic therapies or treatments specifically tailored for heart conditions?
Yeah, of course. In view of the causative factors, the dietary and lifestyle recommendation be followed to pacify the vitiated doshas. Number one. Number two, care of dyslipidemia be taken by using herbs like guduchi, pushkarmul, garlic, guglu, triphala, and shilajit. These drugs have shown good results on taking care of dyslipidemia. Dyslipidemia means high level of cholesterol and triglyceride and bad cholesterol and lowering of good cholesterol, that is HDL. Cardiotonic drugs like Arjuna is the drug of choice. Classically, Arjuna wrist is also available. Moreover, Pushkarmul and Gokhru that also have shown good results. In chronic conditions, when acute phase is over and pay after 6 months, then we can administer Guglu-based formulation because Guglu has also shown hypolipidemic and hypocholesteremic effect. Weight management should be done, and wherever required, later on, Panchakarma purificatory procedures can also be adopted.
Okay, okay. So there are many therapies and treatments that can treat heart conditions, and I'm sure with the amount of overlap Ayurveda has in itself, this can promote overall health as well. Now, coming to the diseases we have discussed earlier in the series, like diabetes, hypertension. Now, these are also diseases very prevalent in not only the Indian society but all over the world. So, do these diseases like diabetes and hypertension or blood pressure, high blood pressure, adversely affect the health of the heart?
Yes, of course. The diseases like not only diabetes and high blood pressure, rather obesity, atherosclerotic conditions, smoking, consumption of alcohol also adversely affect the health of the heart. The dyslipidemia plays a very important role. High level of cholesterol, lipid, free fatty acids, triglycerides, LDL, and low level of HDL leads to metabolic syndrome, diabetic conditions, atherosclerosis, and other things. Uncontrolled blood pressure and uncontrolled diabetes ultimately involve the heart. It leads to left ventricular hypertrophy and ischemic heart disease conditions. So, diabetes, high blood pressure, both the condition hasten the process of atherosclerosis, and ultimately it leads to coronary insufficiency and blood supply towards heart is affected, and it leads to ischemic heart disease. Overweight also increases the load on heart. So all these conditions adversely affect the health of the heart, especially
Okay.
diabetes, high blood pressure.
Okay, okay. So in general life, like our health, our well-being, our bodies, our minds are all connected. So when one part of your life or your body is affected, you can kind of be sure that it can have an effect on the rest of your health and life as well. So Dr. Chandola has a diploma in yoga, as we learned in the beginning. So want to ask you, Dr. Chandola, what is the role of yoga and how can it promote heart health?
Beautiful question you have asked, Kritika ji. The yoga take care of not only of physical health, rather mental health as well. So various yogic asanas, kriya, and pranayam, they have shown positive results in taking care of the health of the heart. Tadasan or mountain pose, it helps in strengthening the vertebral column and heart. The deep breathing involved expand the lungs. Vrkshasan or tree pose, this also opens the heart and shoulders. Utthita Hastapadasan, that is standing big toe hold. It increases stamina. Veerbhadrasan or warrior pose, it keeps the heart rate in check. Bhujangasana or cobra pose also strengthens the chest muscles and expand the lung region, increasing its capacity. Utkatasana or chair pose, it stimulates the heart and stretches the chest. The role of stress is well established in ischemic heart disease. So practice of pranayam, shavasana, makarasan, nispandabhav, which are the relaxation technique, and they have shown the anti-catecholaminic effect. They relaxes the muscles and improves the circulation towards heart. So all these have proven efficacy in relieving stress, anxiety, tension, frustration, depression, ultimately improving microcirculation towards the vital organs like brain and heart with maximum oxygenation.
All right. Okay. So yoga we always discuss in each of our session because it is just that good. No real no exercise can come close to the effect that yoga has not only on physical well-being but also mental well-being. Now, Dr. Chandola, this is a question I'm sure many of our audience members would have, which is it safe to give Ayurvedic treatment simultaneously along with modern conventional medicine for heart-related ailments?
Yeah, I think there is no harm if, along with modern conventional treatment, Ayurvedic medicaments are also added. It has synergetic effect, not only potentiate therapeutic efficacy of the conventional drugs, rather also counteract the unwanted effect of the modern synthetic drugs. Secondly, Ayurvedic diet and lifestyle recommendation will take care of the predisposing factors, especially overweight, sedentary habits, dyslipidemia, and associated diseases like hypertension, diabetes, obesity, and metabolic syndrome. Use of Ayurvedic kitchen spices like haldi, jeera, dhania, hing, dalchini, methi, and herbs like Arjun, Gokhru, Pushkarmul, Ashwagandha, Tulsi, Brahmi have shown proven efficacy in taking care of the ischemic heart diseases. For congestive heart failure, along with Arjuna-based formulations, Ayurvedic diuretics like Purnarnava Gokhru and classical formulation like Purnarnavashta Kwat, Tarn Panchmul Kwat can also be added, and that will help ultimately in reducing load on the heart. Moreover, emerging risk factors like calcium supplementation, vitamin D deficiency, infection due to Helicobacter pylori should also be taken care of. So there is no harm, rather it will be helpful if Ayurveda is combined with the synthetic drugs. We can keep a half to 1 hour difference between the administration of allopathic synthetic drugs and the Ayurvedic drugs of natural origin.
Understood, understood. And like we usually discuss, don't wait till the end to seek out Ayurvedic help. Consider Ayurveda one of your first choices as well. Now, Dr. Chandola, you, along us answering all these questions, you had mentioned various herbs and ingredients that have Ayurvedic properties and that can act as a medicine. So, can we kind of talk about those specific Ayurvedic herbs again that specifically help with heart disease?
See, in Charak Samhita, classically, they have mentioned about Pushkarmul, that is Inula racemosa. Lot of work has been done on this Pushkarmul experimentally also. The experimental animal, by injecting isoprenaline, the model for infarction was created. And then alcoholic extract of Inula racemosa was given. The whole pattern of MI was reversed. So Pushkar
Okay.
Mool is a very good drug. It is hypolipidemic, anti-hyperglycemic, and having coronary dilator effect. Arjun,
Okay.
Terminalia Arjuna. Lot of emphasis is given on this bark of Arjun tree.
Okay.
Triphala, Jeera, Ajwain, especially recommended. Arjun has shown anti-catecholaminic effect. It is
Okay.
cardiotonic drug. Moreover, scientists have identified a saponin in Gokhru,
Okay.
which is coronary dilator. So this Gokhru is also a very good drug for taking care of the health of the heart. Arjunarist and Arjun Ghrat are available everywhere, and we can develop our own formulation by combining powder of Arjun, Gokhru, Pushkarmul. Brahmi, etc., depending upon clinical condition of the patient.
Okay.
To reduce the load on the heart, we can use Ayurvedic diuretics like Purnarnava, Gokhru, Purnarnavashtakvat, Tranpanchmulkvat. And once a acute stage of myocardial infarction is over, 6 month period is over, then we can add Guglu, purified Guglu resin. It has
Okay.
shown hypocholestemic and hypolipidemic activity. It will improve the micro circulation, but not in acute condition. It should be used once a 6 month period is over. So
Okay.
in that way, all these can be combinedly given. No problem.
Understood. Understood. So, with among the herbs that you had mentioned, Arjuna is pretty interesting, and there is a video that we have created on this as well, just for your further understanding. So, you can find the link in the chat box below, and you can definitely check out the video and learn more about this particular herb if you are curious. Now, finally, Dr. Chandola, we spoke about a lot of aspects today, and it's a lot of knowledge. Are there any ebooks for easy understanding of, not just about heart disease, but also lifestyle adaptations we can do in general from the Ayurvedic way?
Yeah, various ebooks are available on diabetes, obesity, weight management, dietary lifestyle recommendations, cardiac health, and these are available on Live Ayur web platform, where under the cardiac ebook, the interested person can go through the recommended diet, lifestyle, fruits, spices, pulses, and what should be done, what should not be done. It is discussed in detail in that cardiac ebook under this Live Ayur platform.
Fantastic. You can find the link to the ebooks pasted in the chat box as well. Please be sure to check those out. Now, if the audience doesn't have any questions, then we come to the end of our session. That was truly insightful, Dr. Chandola. Thank you so much again for your time. Your expertise is an honor to have here. And thank you for sharing such detailed information.
Thank you.
I'm sure the audience will greatly benefit from it. I'd also like to thank our audience for being a part of this, repeatedly being here with us, making these sessions happen, and we hope this session was just as insightful for you. Our next session will be on February 22nd, and it'll be around cancer and Ayurveda, a very interesting topic. With this, we'd like to end the session here. Audience, you can visit the Levire website and follow us on social media for regular updates on Ayurveda and the Ayurvedic lifestyle. Thank you, everyone, and have a great rest of your week.
Thank you, Kritika ji. Thank you, Hemanti ji. Thank you very much.
Thank you, everyone.